a lot of the people that I went to school with, when I was getting paid like a lot, they were still not, because of the route that I took. Okay. Hello, LovelyyOT, it's your girl Nancy. I'm back again with another video. If you haven't subscribed yet, come on, really? What are you waiting for? Join the fam, okay? On this channel, I educate, I inform, all things about getting into college, getting into grad school, staying in grad school or college, okay? And then definitely your transition out of college or out of grad school. I also talk a lot about healthcare and what's going on within the healthcare system. And I also talk a lot about therapy, because obviously I'm a therapist. I'm an occupational therapist, okay? So I talk about being an OT and the things that we do and everything else like that. So let's move on to today's video. So today's video, we are going to talk about the frequently asked questions that I get a lot of. Okay, so I have a whole list, so I'm just gonna go down the list and answer these questions for you guys. So the first one that I have on my list is, does it matter what school that I go to? Does it really matter what school that I go to? Now, if you want an in-depth video of what to look for if you are searching for schools and trying to get into grad school or college, I have a video that I just created, and I'm going to link it somewhere up here for you guys to click on. Okay, go ahead and watch that one. It's a really good video. Now, I personally do not think that it matters what school you go to, as far as the most popular schools, the most well-known schools, the Ivy League school. I don't think that necessarily matters. Okay, the name of the school doesn't matter. I've never been to an interview where someone has asked me, hey, what school did you go to? Usually what they do ask of me is, did you graduate? Did you pass your boards? Okay, are you licensed? That's what's important for them, okay? And that has been my personal experience so far, and I've been an occupational therapist for 3 years. So far, and I've been on different interviews because I used to travel. I've worked in different facilities, and no one has asked me that. It has never come up in any kind of conversation whatsoever. So if you are licensed, that's what they care about, okay? All right, number 2. How to pay for OT school. So how did you pay for OT school? I paid for OT school with loans and grants, okay? And I also took a year off after I graduated from undergrad. I took a year off. I worked, I saved a lot of that money towards like books and like boards and food and different things like that. So that's how I paid for school. Okay, so when I talk about loans, I took out a lot of federal loans. Okay. All right. Number 3, was grad school a hard transition or adjustment? From like undergrad, I guess you're saying, my experience, like comparing high school to college to grad school, I would definitely say that grad school was the most challenging, the most difficult, and I think it's because it was just the most intense. It was a lot of material in a span of 3 years, and there's a lot of information that you kind of have to guggle up and kind of have to remember, and different subjects that I never took previously. Like a lot of the classes were very new to me, and the amount of work is definitely a lot more compared to college. Okay, so in that sense, yes, it was a bit of a challenge as far as adjusting to the classes and the pace of the classes and the depth of the material and the different things that I had to study for, and all of that was very challenging a little bit at the beginning, but kind of have to get adjusted to it, because you have to pass that class, you have to get that assignment done, you have to do this, you have to do that. So there's no really time for you to be like, okay, let me learn how to adjust. You don't really learn how to adjust. You kind of just adjust and go with it, because that's what you got to do to pass your courses. Okay, so that's that. Okay, number 3, what did you use to study for the NBCU? Okay, so for the NBCU exam, I have another video that I'm gonna link down below and also up here for you guys to watch, and that video lists all the books, all the resources, all that I did to pass the NBCU. So I really think I have it down pat. When I tell people that, listen, if you watch my video or if you go on my Instagram post and look at all the tips that I've given you guys to pass the boards, if you follow that to the T, there's no reason for you to not pass the boards. Absolutely no reason. I literally listed all this down when I was studying for the NBCUT. After the NBCUT, I put it down. I talked to multiple people, and literally that was the list that most people agree with. So look at that list, watch those videos, and you'll be just fine. The next question is, how was it being a minority in OT school? What was the obstacles? When I was in OT school, I was probably one of one, two, three, four black people, four black girls in my class. How was it? I've also made a video about this too, so I'm gonna link that up here and also down below, so you guys can get a more in-depth answer for this question. Honestly, to tell you guys the truth, it wasn't an obstacle for me at all, because I don't like, my perspective about being a black girl, an African girl, I don't really focus on that too much, because to me, I'm just a human being and I'm trying to live my life and I'm trying to go to school. So I don't really pay too much attention to the fact that I'm black or I'm African, because obviously I am. I look black. Obviously I don't shy away from my blackness or my Africanness. If you know me, you know I speak Chi. I embody everything about me that's African, that's black. However, I don't really pay attention to it, meaning like I don't really let that be an obstacle for me to not get things done, or for me to not do what I want to do. If anything, I use it as a strength, because there's a lot of strength within each one of us that we can use to get where we're going, whether you're black, white, purple, blue, whatever color that you are. So for me, I use my color as strength to do things, to empower myself, to go where people are saying that I can't go. Don't tell me that I can't do something, because that's what I'm going to do. So honestly, I didn't have any obstacles. I worked hard. I put the time in. I was in the lab all day long. I was studying every day, all the time. So for me, I was successful in grad school because I put in the time, okay? And I didn't have any obstacles because I wasn't worried about having obstacles. I was worried about passing my courses and getting the heck out of there. So it's all about your mindset. Don't let your color, don't let anything stop you from achieving your dreams and going after your goals. Like, yes, use that. If anything, use that to empower yourself. Okay? I don't care. I go after what I want to go after, and I don't let my colorness, where I'm from, my culture, whatever, keep me from doing what I gotta do. The next question is, how did you study for T school? Please, once again, I've made videos about a lot of these questions. Please watch these videos. It's not that I don't want to answer it. It's just I don't want to use 1 minute to talk about a video that I spent like 10 minutes on. So go ahead and watch that video. I'm going to link that up here and down here for you guys as well on how I studied. But basically, there's a whole video for that. If you guys want me to make an updated video towards that specific question, I can absolutely do that. But it's how I studied is like an in-depth thing. I use a lot of different techniques and a lot of different methods. I studied all the time, even on the weekends. And so for me, like I said, I was successful because I put in the time. Okay, I wasn't a procrastinator, because being a procrastinator is not going to help you at all in grad school. So please do your studying on time. Study like a week or two before your exams, because it's not like you're taking, sometimes I have like 3 exams in 1 week plus assignments. So there's no room for me to like wait till the last minute to study or wait till the last minute to do things. I had my get yourself an agenda book and write everything down. Get a big ass calendar and put the calendar in your room, so whenever you get up, you can see what you have to do, not just for that day, but for that whole week and for the week after, so you can prepare for it. Okay, the next question that I get a lot of is, can you make a personal statement video? Yes, I will make a personal statement video as soon as possible, and I will post it for you guys. If not this week, definitely next week, so stay tuned for that. The next question is, how can I get cheap CEUs for new grads? I actually signed up for occupationaltherapy.com. I think that's what the website is. Yes, I'm gonna leave that down below as well. And that's where I did all my CEUs. You pay $100 or $99 or $100. I think it's 99 plus tax for a whole year, and you can do unlimited CEUs. How amazing is that? So that's what I did. I think that's the cheapest one that I found so far, and they have so many different topics. It's so in depth and it's amazing. The next question is how to prepare for grad school. What subjects to brush on? Definitely brush on subjects in relation to neuroanatomy, kinesiology, definitely functional anatomy. Definitely learning about the different diagnoses out there, and I have a book on this that has all the different diagnoses, how they present, the symptoms, and what to do, like the medical management and therapy and all that. So if you can get a book like that, I'm going to leave a book link down below for you guys, because I do have that book, but it's not with me right now. But any kind of book that has all the diagnosis. So know what, if someone's asking you, hey, can you tell me about what MS is? You should know that. What is MS? What are the symptoms? What is Parkinson's? What are the symptoms? Know the level of the spinal cord injury. You're going to need to know that. Learn about dementia, Alzheimer's, all the different diagnoses out there. You need to know. Must have for OT school. What are the must haves? I have a video on this as well, so I'm going to leave that down below. I feel like I kind of pre-thought all of these questions way back, and I've made tons of video on a lot of these questions. So I'm going to link that below for you guys as well. The next question is level 1 field work. Okay, I'm doing my level 1 field work through Zoom. Is this a disadvantage? And it's geriatrics. Okay, I cannot speak. I wish I can speak on this and help you guys, because I feel like I've had a lot of questions on this ever since the COVID-19 on how I feel about field work being done via Zoom. I didn't do my field work on Zoom, and I'm a very hands-on person. I don't like someone to tell me da 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 da. I want to do da 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 da. Okay, I want to do it for myself. I want to feel it. I want to touch it. I need my hands on. That's how I study. Okay, read it, look at it, do it yourself, hands on. I feel like I got more when I was in OT school. I feel like I got more out of the labs than I did in the classes, because with the PowerPoints and stuff, I can read that. I don't need nobody to read that for me. I can read that, but I need someone to teach me how to do a transfer, how to make a splint, how to do that. Reading about a splint and actually making one is two totally different things. So for me, I want both. I want to read about it, and I want to be able to do it and see if I can do it. And if I can't do it, teach me how to do it, because that's the only way that I can take it from here, reading it, to here and to here. For me, I don't know how Zoom is going to work. Honestly, I really don't. Like, I really don't know how they're going to do that and how that's going to work. Maybe like telehealth and stuff, maybe that can work, like teaching kids different skills and stuff like that. But anything and everything is possible, so I'm not gonna sit here and be like, okay, maybe it's not possible. But for me, I just don't know how, especially depending on the different facilities. Like, how would that, maybe if you watch me do a transfer and maybe you try it on like a relative or something like that, maybe then you can transfer the learning in that way. But other than that, I really don't know. I don't know how that's gonna work. The next question is, did you feel competent as a new grad? I felt more, honestly speaking, I felt okay, because how do you really measure competence? I feel like learning is a journey and you never really stop learning. Did I feel confident that I knew everything? Absolutely not, because I still don't know everything. Did I feel like, okay, I can go in there and I can know something, I know what I'm doing in a way? Yes. And the only reason why is because, and I've said this in multiple videos, make sure that whatever job your first job is going to be, make sure that you do one of your level 2 field works in that particular setting, because that increases your confidence and your competence so much more. So for me, I did one of my level 2 in a skilled nursing facility for 6 weeks. 6 plus for 12 weeks. So after I graduated and I started looking for, I started traveling, I made sure that I look for travel jobs in skilled nursing facilities because that's what I had an experience with. Okay, and that made it a lot better, smoother transition for me. I wanted to be able to go into my first job and know what the hell I'm doing, and that's what I did. So for me, yes, I felt a lot more confident because I was familiar with that particular setting. Do you recommend travel to new grads? Yes, absolutely, 110%. Yes, 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 yes. And I've said this before and I'll say it again. Okay, especially if you get your first travel assignment in a setting that you did your level 2 clinicals in. Okay, so that it's smoother for you and you're not going crazy. Okay, and also the number 2 reason why I also recommend traveling, I did it even though a lot of people are like, girl, don't do it, don't do it. I'm like, don't tell me don't do something because I'm gonna do it. Okay, the second reason why I did it was definitely because of the pay rate. I'm gonna be honest, that's why I did it. Okay, I knew that as a traveler I'm gonna get more pay compared to other new grads that just came out of school, because obviously if you're a new grad and you're taking a permanent position, a lot of companies want the new grads because they don't want to pay them that much. So a lot of them prefer new grads to get into these permanent positions. So I was like, and not pay them well, right? So I was like, you know what? No, I'm not doing that. Okay, I spent 3 years in grad school, and I want to be paid how much I'm supposed to get paid, new grad or not. So that's what I did. So I was like, I'm gonna go the travel way so that I can start making a lot of money as soon as possible, and that's exactly what happened for me. But it definitely has its pros and cons. Everything has its pros and cons. A lot of the people that I went to school with, when I was getting paid like a lot, they were still not because of the route that I took. Okay, I wasn't gonna go backwards. We gotta go forward. Okay, so yes, yes. And if you guys want more information, more help on that, especially if you are going to the skilled nursing facility, because that's where I am like a pro at. I'm like a pro skilled nursing facility OT. Okay, so if you need any help on that, definitely let me know. The next question is, what category of patients do you treat? I see all type of diagnosis, and I treat older adults. So I think the youngest patient that I have probably in their 20s all the way to like the hundreds. Okay, that's my population. And I've treated all type of diagnoses: physical diagnosis, neurological diagnosis, mental diagnosis. So from amputees to like MS, spinal cord injuries, motor vehicle accident injuries. I've seen burn injuries. I've seen a lot of ortho patients. I've seen a lot of variations of patients. So yes. Can I get admission to a doctor program with a bachelor's degree? I think so. Yes. Yes, you can. However, because I know for a fact that when I started looking into a doctor program, because I have my master's, some of the requirements were different for me compared to if I only had my bachelor's degree. Okay, so just look, depending on the school, the requirements will definitely be different. But yes, that's definitely a possibility. Now, before I get to the last FAQ, you guys as well, make sure that you subscribe. Come on, okay, subscribe. I'm going to start putting 2 videos a week, so every Wednesday and Sunday. Please make sure that you come back on my channel and watch a new video. If you have a video idea for me, I always welcome these. Please make sure that you leave that down below for me. Make sure that you follow me on Instagram. I post a lot more on Instagram. I'm going to do a lot more on Instagram as far as like how-tos and different things that I do at work and things like that. I will definitely want to start doing that a lot more. So make sure that you follow me on Instagram so you don't miss out on there. I'm also on Instagram a lot. So if you have any questions, that's the best place that you can reach me. Email, I try to check my email as much as I can, but you can also send me an email as well. And all that information right down there. Okay, and now to the last FAQ. Who are some people or influencers that you look up to? If you know me, I really follow a lot of motivational speakers, a lot of spiritual leaders, because I'm very spiritual. Okay, and so definitely anybody who's a spiritual leader, I kind of go blank on people. I also love self-development type of like books and Instagram pages and stuff like that. So TD Jakes definitely for the spiritual aspect. I listen to Gary Vee because he's a very like self-development type of person. I also listen to Sadhguru. He's Indian. He's this Indian like spiritual person. I listen to him a lot. Just different people. As long as your page has like motivational stuff and like self-development type things, spiritual type thing, I definitely follow and listen to people like that on YouTube, or they're reading books or stuff like that. If you guys want me to do a video specifically on that alone, let me know down below. That was it. All right, I'll see you guys in the next video. Bye.